everyone. This is Dr. NainaMD Fusion of Science and Beauty. Welcome to my show, and I want to welcome my first guest. This is Mr. Mike McCann. He's the CEO of HeartSmart. It's a company that is amazingly progressive. You know, in anti-aging and regenerative medicine, and being my passion to really get the knowledge out there, there's a lot of heart disease, as you all know, that we see, correct?
Correct.
And a lot of times it's based on, and I think what the audience is just familiar with is saying, they go to the doctor and they say, hey, the doctor said my cholesterol results were normal. This is great. And they feel so happy. And what I have to educate them is that, wait a minute, just because your cholesterol is normal does not tell me that LDL, when you split the cholesterol right into the good and the bad, well, if your bad one is supposed to be less than 100. But let's just say that cholesterol, which is less than 100, okay? Well, let's just say you profile it further, and it's composed of small, dense particles, or it's got this something called remnant lipoprotein, or it's got this particle number is really high. That's a time bomb. That's a time bomb waiting to happen. That's all the things that you don't want. Versus if that LDL that was less than 100 was more of a high dense or a low particle number. For example, let's say I have a LDL of 130, okay? I'm higher. I should be like doing something. And you have an LDL of, let's say, 100, okay? But if yours was the small, dense, and it was really, you know, all the things that I talk about, you're the time bomb, not me. And people don't understand that. Is how do we figure that out? It's a misperception simply to say, hey, my LDL number is like less than 100 and it's great. No, there still could be serious heart disease. And your company, I readily use this company in my clinic because I think it's phenomenal, the technology that you've come out with to be able to identify much early on before an event occurs, like before a heart attack or before an obstruction to the arteries that the patient becomes really symptomatic, that you're able to kind of say, wait a minute, this is another test people can do, and that means that they need to, if it was abnormal, then they need to go see their cardiologist or their doctor to get further testing, right? Just
Correct.
Other than just a cholesterol.
Yes.
So please explain this technology and tell us about the different kind of plaques that there are, and let the audience know. What I want the take-home messages is that it's just not your LDL. It's not about just your cholesterol that predicts your heart disease.
Well, you're absolutely correct. 50% of heart attacks occur in people with what is considered normal cholesterol.
Exactly.
And it's the undetected disease that's the big risk factor. If we
Right.
can detect disease early, then we can do something about it through dietary changes, lifestyle, and you can actually reverse atherosclerosis, which most people are surprised to hear.
Yeah.
The HeartSmart test uses non-invasive...
You know, before you go into that, I'm going to interrupt and say, most people are, why are people so surprised to hear, and why is conventional medicine so surprised that, oh my gosh, how can you possibly reverse the atherosclerosis?
Well, some people think that once they have heart disease, they have it for life.
Yeah.
But it can be mitigated, or even if you arrest progression, it's a big victory.
Yeah.
So what you want to do is protect your heart. The difficulty that most people have is that
They can't see
test,
it. Yeah, there's no
you
test.
can't see it because most of the tests are telling you what your risk factors are.
Yeah.
The HeartSmart test tells you if there's actually disease present.
And you know, going back to that before you explain the technology, when you said 50% of the heart attacks occur, well, we thought always that that's how the traditional thinking is, that you have to complete obstruction, right, of the plaque.
Right.
Well, 50%, what that means is it's known as a silent killer. Time magazine, at least I think 5-6 years ago, had an article called The Silent Killer, and they said that it's that little bit of plaque. You don't have to have a full occlusion, but that little bit of plaque breaks off, travels, lodges into a smaller artery, and causes a heart attack. So what is the instability of that plaque, right? That block,
Right.
instability of this plaque, or the inflammation that's causing the plaque to break off and lodge. And that's what your technology tests for. And that's what I think is so important to emphasize, is that's what you're looking at.
The HeartSmart uses a simple ultrasound scan of the carotid arteries, which we can image because they're very close to the surface
And the
of the
carotid
skin.
arteries are right here, right?
Right, in the neck. And then we can image that and we can see the buildup of atherosclerosis that we all get. But equally important is that we look for the presence of plaque that may be in the arteries.
And plaque is like, and describe the plaque, what plaque is.
Well, the plaque can be just a small intrusion into the lumen or the area where the blood flows. When it gets severe, it impedes blood flow and you get blockage.
Yeah.
And then that's what most people think a heart attack is from. But there can be very small plaques that are soft, that get vulnerable to rupture, and that break off and go to the heart or the brain, causing a heart attack or stroke.
They travel. It's a traveling plaque, right? It's a traveling plaque. That's the big one.
That's correct. And so by spotting this early on, then we can take measures to rectify it, and we can monitor the patient's health. And perhaps where it's more severe, you may need additional testing and be referred to a specialist. But the beauty of the test is it can be done right here in your office.
I know you do it. We do it all the time. So tell how it's done.
It's a simple test. It takes about 10 minutes.
The patient pretty much sits down, right?
Patient sits down. We use ultrasound, which is the same thing they use on babies, so there's no radiation.
Exactly, and so I know we just put the transducer. It's called a transducer. You just kind of, there's a specific way that we have to kind of like put it over the carotid artery, right?
Right, and we get a movie of the entire carotid tree, and then that's sent to our lab, and we...
And I directly send it to your lab right from the computer. It goes directly to you guys, right?
Right.
All HIPAA security, of course, but it goes directly to you.
And then we get a report back to you that also gives the patient a grade, so the patient immediately understands the state of their cardiovascular health. If we see pathology or the early stages of disease, we can take means to rectify that. Yep. But if we don't, if you get all A's, that's a lot of peace of mind.
Yeah, I mean, isn't that nice? So that, in other words, you always hear about, oh my gosh, and he had normal cholesterol levels, and look what happened to him or her, and had a heart attack. They exercised, they did this, their cholesterol was low. Well, nobody was checking for this kind of a plaque.
Right. At 70% blockage of your arteries, you can still pass a stress test, except that 86% of heart attacks occur in people with less than 70%. That's why Tim Russert died of a heart attack 6 weeks after he had a stress test, because they did no imaging.
And what if he had done this test? Who knows? Right?
Who knows?
Yeah. Exactly.
Might have saved his life, or might have identified disease the doctors would have taken differently.
And I think that's part of the anti-aging regenerative, because as we're looking and striving for quality of life issues, and as we're trying to figure out, how we can maintain our quality of life and how we can be the 50s at an age of 80, then part of that is very valuable tools is testing. Yes. I'm very critical on the kind of, even a lab test, what kind of method did they use, and how is this test done, because that is so important. I don't take just like, if a person says, okay, let's say my cholesterol level was this, it changes. How consistently did you take a cholesterol level, let's say for like 3 or 4 times over 3 or 4 weeks? So nobody can do that. Instead, your test at least gives a peace of mind where, wow, at least anatomically I'm not seeing any unstable plaque.
That's
so
correct.
I think it's a great way. So you gave me this book, which, by the way, I'm a biochemistry. It's a confession. I have to read biochemistry every day. That's my addiction. So I read this book. This is the book, and the name of the book is Beat the Heart Attack Gene. Can you just tell a little bit about what this book is? I think it's phenomenal.
Well, it's a great book that tells you about early detection of cardiovascular disease, why it's important, and the various things you can test for. And of course, one of the key things is the carotid IMT test, like the HeartSmart test, that looks at the actual state of disease. They refer to it as the cat in the gutter. It's just waiting there to pounce if you're not aware that disease is actually present.
Yeah, no, absolutely. It's a phenomenal book, and this is what actually a sample report looks like from the company. It really gives you a picture. They actually are able to identify. You're able to identify whether the plaque is kind of walk the audience through this. The ABC report card that they get.
Right, it's just a letter grade. We all went to high school. We know we're supposed to get straight A's.
Right.
But if we don't, we know that we need to study more or work harder. Well, this is the same thing.
Yeah.
It's saying that if we're not all A's, then we've got
like
something
this guy,
going on.
like this guy is pretty okay. You can, but this one, this one is bad because you can. Here is like you could have an unstable plaque.
Well, I think this is significant because a lot of times people, if they just measure the intimal media thickness of the atherosclerosis, it may not tell the whole story because
Exactly.
we see many cases like this where it's not particularly large,
Yeah.
but this happened to be a woman who had a lot of plaque. She had as much plaque as I've ever seen in like 5 or 6 places in her carotid arteries, some of which were soft. And a lot of women don't realize that postmenopausal, they start to get a rapid thickening of the
Yes.
arteries wall, and they start to develop more plaque. That's why 55,000 more women have strokes every year than men.
And what,
in
you
the
know,
United
isn't that
States.
amazing that it's been always a pet peeve of mine. I always, in my practice, anytime a woman complained of anything that was that I felt that could be heart issue, immediately I was doing a heart evaluation on her. So many women are just, they're just not picked up. We are so, in society, I think we're more readily to do or more apt to do a stress test on a man than we
Yes.
are on a female. Don't you agree with that statement?
I do, and I think women are vastly under-tested.
They're vastly
and they
under-tested.
don't recognize that what a danger heart disease is, because for every woman that dies of breast cancer, which they appropriately fear
Yeah.
greatly, 10 die from a heart attack.
Yeah, there are more women dying of heart attack than there are women dying of breast cancer, and this is so important to realize. And this would be an amazing report. Just give me one example of someone that you might have come across that did this. And you remember the head of someone that was very
Yeah, there's a very prominent individual in the
in
basically
the anti-aging
healthcare-
community.
In the anti-aging community,
Yeah.
wonderful shape. I mean, a physical specimen.
He is an amazing shape. I know him because he was my mentor.
And he has 2 stents now because we detected disease and plaque in the body that led him to go to further testing. The Heart Smart test is the first stage. It's for the early detection. And if we see significant pathology, then we can get to the cardiologist or the appropriate specialist.
Yeah.
And in some cases, we've had a woman who had 85% occlusion in one artery and 100% in another, and had never had an event. And what most
She was
people don't
lucky.
realize, for most people, the first symptom of heart disease is a heart attack.
Yeah.
And 1 in 4 first-time heart attacks is fatal. And for women, that's 1 in 3. As one of my clients said, the major symptom of heart disease is death.
Yeah.
So
because you don't know it. It's
and
a
everyone-
silent killer. And that's why it is a silent killer. And you understand that acute death, when somebody says, oh, this dies suddenly, there's usually the main reason is a heart attack. That's one of the
correct.
reasons of, I mean, unless you choke or I mean, if you have a stroke, you're not going to acutely die. But acute death sudden death is usually a heart attack.
That's correct.
And I mean, it's so important, and I think we're in an epidemic of missing heart disease.
And particularly for women, because their
Yes.
symptoms are so different and they're often not recognized.
Yeah, and postmenopausal women, I deal a lot with hormonal issues, so I know that a lot of the hormones are affecting women. And so many of my female patients will come to me and say, you know, they're so scared of having a heart disease because they know in their population they're at risk for that. And, you know, we go and balance, of course, I go and balance the hormones and so forth, which helps a lot in decreasing the inflammation. But really it is a lack of a lot of the hormones, lack of estrogen, lack of progesterone in the right ratios, and testosterone. Did you know, for example, that in testosterone, where are the maximum receptors of testosterone? Heart. It's in the heart. And here that's going to be a whole other show about the misperception of testosterone. So I'm so glad that you were able to come today. I think your company is one of the leading forefront companies in anti-aging and regenerative medicine. And that's why I wanted to bring you on. It's fabulous work you're doing. You're the CEO of the company. Please keep doing the good work. And I am going to be doing the testing. I think it's one of the best things any doctor can do.
Well, I appreciate your having us here.
Yes. Thank you. Thank you for coming. This is Dr. Naina. We'll be right back with my next guest, NainaMD, Fusion of Science and Beauty. Hello, everyone. Welcome back to my show. This is NainaMD, Beverly Hills, Fusion of Science and Beauty. And I have an amazing guest today. He is double board certified plastic surgeon. You can't get any better than that. And right here in Beverly Hills. very well known, Dr. Corbin. How are you?
Thank you for having me back. Thank you so much. Doing well.
He has come to my show before. I hope you guys had a chance to see him. We discussed eye rejuvenation, fabulous discussion we had. And today I want to talk about nose and nasal reconstruction because so many people, as you know, are having sinus issues, right? They're having allergies, sinus issues, and sometimes a deviated septum. It's not just for cosmetics, that people get surgery to the nose done. And I think it's so important for if you could just go through with what really what we could say a nose job, okay, is really all about, and what we can achieve, and what is the latest greatest in terms of the anti-aging regenerative movement. What are the advances that we've made in nasal, in the nasal reconstruction?
That's a great question.
Yeah.
Yeah. Well, in anti-aging and this new world of exercise, yoga, and this thought that breathing is so important for sleep, for exercise. Nasal breathing has become on the forefront of just the actual functionality of the nose. And with that comes chronic sinusitis can also make breathing bad. So
how many people do you think? There's a lot of people that are affected, right?
Oh, and especially in this country when there's not many windows that are open or circulated air.
And we're getting into a very toxic environment and just so much we suffer.
Yeah, and nasal breathing is really in the forefront of improving someone's breathing is through having a functional nose.
Right.
And so the latest and greatest now is actually putting beauty and function together. So deviated septum, as we can call it, is simply the nose is on the inside crooked. Then also there's external factors if you have collapse of the nose. So function to make a nose structured so it breathes well also has to look good, natural, and harmonize with the rest of the face. So the latest and greatest now is going to surgeons who believe in form and function, and that's very important.
Yeah. And for those of you who says he's looking really young, he looks super young, but he's in practice for a long time. Really, years and years and years.
It was a nasal surgery I had.
You do not have one wrinkle on your face.
Thank you very much.
So, but what's the first thing that you see in terms of when you have in nasal reconstruction? What would you say the first the driving force behind the patients that you get?
I get two types of patients. Number one is someone who can't breathe, and based on their nasal exam is that they need a functional nose as well as an improved sense of the nose, how it fits with the face. And then there's the cosmetic patient who just wants cosmetically to fit with the face. But both patients deserve a great evaluation and a functioning, natural appearing nose. So people don't look at the nose, people should just look at someone's eyes. That's the most important to me, is someone should look at the eyes and never say you have a perfect nose. That's not what you want. You want a nose that harmonizes with everything.
I love that. I love that because I think that is you said it. So much of the, so many times, sometimes if there is a nasal reconstruction done for cosmetic, it's like the focus is so much on the nose, and it's the eyes. You're absolutely right. It's the eyes. That's a true sense of beauty, and the nose should just sort of blend in and just say, hey, this is just like everything just looks very symmetrical, very just blended. And then you can focus absolutely on the eyes.
And if it functions well, meaning the patient breathes better, is able to sleep better. Snoring can often be improved, not always. And also the more you sleep, better exercise, you do look younger, and then that with what you do when I send patients to you is the anti-aging portion of once they have that exercise improvement, they're on their way to looking and feeling younger.
Absolutely. What is, in terms of, tell about the surgery, how long is generally the surgery? And then after, are you like, is there bruising around the eye area, or how long does all that take? I know you have to have nasal packs and so forth, and is it usually about like a week or two?
Yeah, you want to customize the nasal procedure for every patient, but in general, the surgery itself can take anywhere from 2, 3, or 4 hours. Patients under general anesthesia in general, and the patient comes back in 1 week, and the cast and any kind of splints or any kind of packings, which are very minimal, come out. At the 1 week mark. Bruising is very minimal. Expect some bruising around the eyes, but in general, over the years, I've seen that I get less and less and almost nothing, and usually it's all gone by 5, 6, 7 days.
Usually it's all technique driven, because if you're getting less and less.
We like to say so.
That's great. Listen, I know that we've, like the last year we talked about all the eye rejuvenation. I know we've touched on the nasal, but I want to ask you something personal.
Oh, great.
I want to know how do you take care of yourself? You have to tell me what time do you get up, and then what do you eat? I want to know everything. I always ask this a lot of people because I'm a fanatic about what people eat. So this is like, okay, you guys, this is a confession.
So the truth has to come out.
It has to come out.
It has to come out.
So when you get up, what do you eat?
Well, the truth has to set me free. I believe, right?
You have. Yeah.
I have to be very honest. I have a 4 and a 2-year-old, and so
Yes.
running after them is where I get most of my exercise.
Wow.
But in general, I always tell patients try, and I have to admit, I try. We all want to have a diet, a good diet. We also all want to have a good
Yeah.
exercise program, and we want to feel
So
good
what do you
about
get when you
ourselves.
get up? What do you do?
So when I get up, it's
Yeah.
always like 2 glasses of water first, and some
Perfect.
orange juice, and get my vitamins are things that you've recommended.
Yeah.
Then you try. Breakfast is supposed to be the most important part, but when you're waking up at 6 a.m. for surgery,
Okay, yeah, you're
I
not-
often don't get a breakfast, and I'll be honest about that.
Yeah.
But my kind of the reason I feel good is that I would like a better diet exercise program. However, what works for me is that when I eat a meal, I do eat what I like and
Yeah.
don't stop myself, but I don't snack. I never eat sweets in between meals. I never eat
Wow.
snacks. Even if someone brings in something to the office, I usually don't have anything between meals.
How much water do you drink?
I am, depending on my day and my throat, you like to get 8 glasses of
Yeah,
water.
to try to get
I
it.
get about 3 or 4.
4, okay,
Yep.
okay.
And then running behind my kids always helps, and then playing tennis. And then,
That's your hobby?
That is,
Tennis?
yeah, as much as we can get that in.
Fabulous.
But running after a 4-year-old and 2-year-old, a gymnastics class can kind of give me my
Oh,
exercise.
I can imagine. Yeah, I know when my kids were little. What do you like? Is there something that you absolutely like in your mind? Say, I have to do this on it. Like your 2 glasses of water. Okay. Is there something else that you do that you're just like, okay, you're like totally sort of like obsessed about that? I have to do this to stay healthy. Is there something in your mind that you absolutely have to do? Give me that. Give me that secret.
That's
I
a
want to know
great
your
question.
secret.
My secret.
Because you don't have one wrinkle on your face. The audience wants to know.
I think it is to feel good about yourself, and I think the one thing I really make sure I do is that I connect with friends and family. I'd spend time with interacting with friends and be able to laugh, have fun, and talk about what's on your mind. I think the most important about me are my relationships.
So it's really your energy, right?
And how
So
you
it all
feel about
comes back to
yourself
that's how you
connects
have-
to
yeah,
exercise,
yeah.
food. If you don't feel good about yourself, you're not going to go interact with others. So for me, I do everything I can to feel happy so I can be around and interact with people. That's where I get my youth and strength.
Do you do, so now I'm going to ask you the next question. As a plastic surgeon, okay, we have estheticians who give their opinions. I, as an anti-aging expert, have my whole take on what are good topicals.
Yep.
What are like some of the latest, greatest, the rejuvenate anti-aging, regenerative medicine? What are your like top picks for like or ingredients for like giving that people should absolutely be on in
Right.
terms of creams or maybe eye creams or whatever?
Well, I know in your background you've had a significant amount of history in the anti-aging of topicals, and so I don't have a favorite. I always go with what's the science.
Do you like
Anything-
vitamin C, topical vitamin C?
Absolutely. Anything
Yeah.
that can give the skin a chance to regenerate more
Yeah.
volume, which is collagen and elastin, which is the two
Anything that's going to build
topics.
that up, yeah.
And so
Yeah,
those are
hyaluronic
vitamin
acid,
C.
you're familiar with that, yeah, hyaluronic acid, which
acid,
builds
yep.
up amazing volume. And I always touch on it. There's like low and medium and high molecular weight, and as you get the low,
Correct.
it goes right more into through the dermis. The high will stay and plump the skin up. So I mean that's an amazing
Right, and that's the
ingredient.
science. And anything that can
Yeah.
help those factors, your normal body to heal itself, those are the best things. So there are ultrasound machines, there's non-surgical options, there's
Do you have-
laser
do you have
treatment.
lasers? Do you have
Yeah, we have
lasers?
Ulthera.
Yeah.
Ulthera is an ultrasound that helps
Yeah.
thicken the skin and give a skin tightening or a lift.
Yeah, you
There are
like that-
lasers.
you like that one?
I think it's good for the right patient.
Yeah.
You get about 10 to 20% of a facelift experience,
Fabulous.
but there are topicals that you want, vitamin C, there are retin-A, hydroquinone, things like that help to regenerate the skin. But the point is to meet with a professional and think about
Yeah.
options and get something that has science behind it.
Absolutely.
Yeah.
What in terms of there's for example, last time we hit on the rejuvenate, we've got Latisse,
Correct.
which can build up. Now hair loss is a huge thing. So as a plastic surgeon, do you get like where people come to you and say, look, I'm losing my eyebrow hair, or I'm losing my eyelashes, or I'm losing my scalp? Have you touched on any of those treatments in terms of scalp?
Yeah, and I think that the anti-aging whole discussion goes with youthfulness and hair.
It's huge.
For men
We are seeing
and
so
women.
many women and men losing hair, and all. I mean, I have a spiel on that, but
And I'm sure
what
you
is
have a
your take?
scientific reason for it more than
Yeah,
mine.
but you're seeing it, right?
Yeah, we're seeing it, and every patient, even if we do the nose, we do the eyes, but then they say, but my hair is thinning, or my forehead is getting enlarged or elongated. I think hair is a big topic right now, especially for men, for their confidence, for how youthful they feel inside.
Yeah.
They fixate on it, and women as well. Of course,
Yeah.
it's a little bit more rare for women, but it happens. So let's just start with the eyelashes. Eyelashes is such a great option. We have Latisse now, which is just a topical.
It's amazing.
And over the 1 month to 4 months, you get these elongated lashes that are yours. They're thicker and they're yours. You stop using it, they go away, the risks are low.
It's a lot better option than the hair extensions. I like anything that promotes your own body to produce, right?
And I've seen a lot of allergies that come with the glue. Obviously, the better places are going to use a different type, but I have seen that there's responses to the glue itself. You can also use it on eyebrows to grow.
That's I was just going to mention a couple of it. Just put a little bit on the eyebrows is phenomenal.
Right.
Yeah.
And make sure it doesn't drip because you
can't
get
touch,
it.
isn't it? And it's just a great touch. Like right after you've done the eye rejuvenation, suddenly you've got the hair all around. I think that's very important to mention. You'll be able to stimulate the hair on the eyebrows. Even with the endoscopic eyebrow lift, you've got now the beautiful hair coming back. You've got the hair on the eyelashes. You touch it off for a woman with mascara, and it's just a win-win situation.
Yeah, we call that the topping. So you do a liquid facelift versus a faceless versus Ulthero. Anything we do around the eyes and the face. Longer eyelashes always helps with bringing a little beauty to it. It has not been utilized for obviously the hairline as much, but that's the next thing. I'm not a specialist in hair restoration, but it's a very big topic now, and I think that in your field, with your therapy, possibly that could be the generation of how we can stop hair growth. So I'm going to leave that on you for our next segment.
Absolutely. Listen, I'm so glad you came on again. I'm really, really delighted. And you are going to be one of my regular guests. I don't know if you knew that, but you will come on again.
It'd be a pleasure.
Tell me a little bit about your website, how people can look you up right here in Beverly Hills.
The website, we love to have everyone come visit the website. We've set it up for academic articles for people to learn, also look at before and
amazing.
articles.
Please, audience, please go to this website. Amazing, amazing articles he's put on.
And it's www.drdhir.com. We have plenty of pictures for people to see. We have a blog also as well. I have a personal story about myself going through a nasal surgery and how nasal breathing helped me feel confident and move forward with my life. And so we'd love to have patients come visit us and see what we can do for you.
Well, thank you so much. He's right in the Golden Triangle of Beverly Hills. Please look him up. Thanks so much again for being on the show. And I will be back next week with amazing guests. This is NainaMD, Beverly Hills, Fusion of Science and Beauty. See you next week.